Good morning. Thank you all for attending the Pitt County COVID-19 media session number 13 for April 28th, 2020. We have a special presentation from Dr. Silvernail, and then right after that, we will open up for questions and comments from the media and those watching in on Facebook. So with no further ado, we'll get right to Dr. Silvernail.
First slide when I'm ready. Good morning, Pitt County. This morning I want to start by briefly reviewing how public health surveillance and data collection work. So Mike assures me if I click the button, my slides will come up. All right, so let's talk about estimating disease in a population. And I'd like to start with reviewing some of the challenges we see with novel infections like COVID-19. With these infections, we generally have little or no experience in treating the infection. We have limited diagnostic capabilities, and you all know that has been a hang up throughout this response. In the beginning, there was no test, and there has been limited availability of the test. The testing availability does seem to be improving, and improving very quickly across the nation and locally as well. We have limited options to treat the infection. Sometimes no options to treat a novel infection. We don't have a vaccine for the infection, at least early on in its appearance. Again, I want to remind you that for many infections that we talk about that are infections of public health concern, we've had decades or even centuries of time to study and understand these infections. COVID-19, we have had about 4 months now, pushing 5 months, it'll be 5 months next month of experience with COVID-19. So that is part of the fog of war or the fog of response that we struggle with these novel infections. Okay, next slide. I want you to imagine that you're down by the river, down by the ocean, the water level's high or it's high tide. If you look at the pyramid, when a novel infection presents or emerges, we see the sickest people first. So we see those folks who die, and then we see those folks who get hospitalized, and then we see the people who require medical care at some degree, but maybe they aren't sick enough or don't require hospitalization. And then down below that, there's still below the waterline is this base of people who have very mild disease or perhaps asymptomatic disease. And one of the things we struggle with a new infection like COVID-19 is knowing how big the base of that pyramid is beneath the waterline. And that's something that over time we try to figure out. The next slide talks about how the host, meaning the person, the pathogen, and the infection interact. And so we need a susceptible host to interact with the right pathogen under the right environmental conditions to get the outcome of a disease or an infection in that person. And that's an important concept to keep in mind. We teach this to medical students. We teach this to public health students, to epidemiology students, that there's a process. Often that's represented as a triangle, much like the fire triangle, if you've ever seen that. I chose to use a funnel diagram here to show that we need those three components to get the outcome of an infection in a given individual. When it comes to counting cases, again, public health surveillance, we count cases by county, and that's by county of residence. So if you live in Pitt County, you're counted as one of our cases. If you live in Beaufort County, you're a Beaufort County case, regardless of where you're diagnosed. The county then reports those to the state, and we report our case counts up to the North Carolina Department of Health and Human Services via their system called NCEDS, or North Carolina Electronic Disease Surveillance System. The state aggregates that data and then forwards that on to the federal government, meaning the CDC, who track reportable diseases at a national level. How do we identify cases? Well, a disease needs to be made reportable by the state or the federal government for us to track that disease. Reportable diseases must be reported, and generally that means by a physician or other healthcare provider. It also means that laboratories who conduct testing for that infection must report that infection to public health authorities. Probably the best bang for our money is laboratory reporting on communicable diseases and having that data electronically transmitted into the state system for follow-up by the local health department. Recorded cases, as I mentioned earlier, are then evaluated, and we enter that evaluation in that NCEDS or North Carolina Electronic Disease Surveillance System so that the state can analyze that data. We can analyze it at a county level. The state can analyze it at a state level. How do cases get missed? Next slide. Oops, I went too many slides, I think, Mike. There we go. How do cases get missed? And sometimes an infected individual doesn't seek medical care or doesn't receive medical care. So if they're never diagnosed, that case goes unreported. If a medical provider fails to diagnose the case, where sometimes we might see a patient and say, well, you might have this, but I probably not going to test you or don't think you warrant testing for that. Let's give it some time and the patient gets better and it doesn't get reported. Or sometimes the medical provider simply fails to report the case. And hopefully that's a minority of times, but sometimes it does happen. So where do we start? First, we need a case definition. That means we need to agree on what data points give us a confirmed case or a probable case or a suspected case. For COVID-19, we've been dealing with confirmed cases, meaning they all have a positive test, and that testing is real-time PCR or polymerase chain reaction, the nasal swab for most of you out there. Secondly, we need that reporting structure, which means county to state to federal. And we do have that. That's been a long-standing public health reporting tool. For confirmed cases of COVID-19, we are currently counting and reported confirmed cases only. We're not reporting suspected or probable cases. These individuals all have had a positive real-time PCR or RT-PCR test, and we know they have had or have COVID-19. We understand this number likely undercounts the cases. So when you look at only people who have been tested, we know there are other folks who haven't been tested. We know there are folks who are mildly symptomatic or asymptomatic who haven't been tested. So we understand that that confirmed case count undercounts or underrepresents the true number of cases in our community. Let's move on to the next slide. Improving case counting. One of the things that I've talked about before is the idea of doing some seroprevalence or antibody testing in our community. Antibody or convalescent testing measures antibodies to COVID-19. One of the problems with that is that some antibody tests can cross-react with the normal human coronaviruses. So we have to look very hard at these tests and make sure we use them and understand that data to make sure that we make the right decisions based on that testing. The first antibody that our body produces is called IgM, and that's the acute phase antibody, and that typically appears 2 to 4 weeks after an individual is infected. On Friday, I had enough time to participate in a American College of Occupational Environmental Medicine webinar where they showed a graph that showed that at about 2 weeks, the viral load or the number of copies of virus in an individual drops off precipitously. And that seems to correlate with the time that IgM would appear in a person. IgG, the antibody that in general gives us long-term immunity to an infection, appears somewhere between 4 and 6 weeks after that individual was infected. Studies on other coronaviruses and short-term studies with this coronavirus show that may persist for several months to perhaps a couple of years in time. As I said, we must look closely at the performance of these antibody tests to make sure that we're measuring what we think we're measuring. Even a very good antibody test can have false positives if the prevalence or the amount of disease in the community is low. With that antibody testing, we will have in time a better estimate of the true footprint of the disease in our community here in Pitt County. I'd like to move on and show you some data, both from the county and from the state. This first graph is a graph of the number of total cumulative case count in Pitt County by data specimen collection. It does appear as we hit the top of that we're starting to plateau out in our number of cases. They're still going up, but still going up at a relatively slow rate. Again, probably in that 2 to 4 range a day. So we find that encouraging. The next chart shown in tabular form shows our percentage of positive. So if we take the total number of case results or test results known and look at the percent positive, if we go back to around April 3rd, we were 19% and change. On April 8th, we hit 21.5% change as a percentage of tests being positive. Beginning on April 16th, and we stayed at that 20%, roughly 20% level for several days. On April 16th, we noticed that our percentage positive had decreased a little bit. We're at 18.3. We said, well, that's a good sign. Let's hope that continues. Over the last week, we have seen that trend continue, and we went from running a positive percentage of about 20% to, in this morning's run, being down to about 11.2 or 11.4% positive in our total return testing. I think that also is a good thing. Moving on, the next table shows the state counts as a cumulative test. I can't talk this morning. Cases by test date across the state, and you can see we've had kind of a slowly building humps in that data. Maybe some start to level off or tail off at the end of that, if you wish a little bit. The state cumulative case count also appears to be flattening out. As we get to the top of that, you can see that our cases are still going up on a day-to-day basis, but not going up as fast on a day-to-day basis. So it does appear that we are on the plateau of the epidemic curve. And lastly, as part of this, I wanted to show you the distribution in terms of testing, and you see that about 40% tested are in that 25 to 40 year range, with other groups spread around that more towards the older end. The death rates, which is the graph on the right, and this is again state data, shows that 86% of folks who have died in North Carolina are at the age of 65 or older. That's the end of my presentation, my slide presentation anyways. So, good, Mike? I'm going to go back. I still have some other comments to make.
Oh, okay.
So, I know we have not counted every case in Pitt County. Epidemiology rarely counts every case. We do want to have the best estimate of cases possible, and that does take some time. We need to continue acute testing with real-time PCR and establish a systemic process of measuring seroprevalence in our community or antibody testing in our community. We are working with ECU and the Brody School of Medicine on a prevalence study here in Pitt County. This partnership also includes some other academic institutions and the North Carolina Department of Health and Human Services. We hope to have that up and running here in a couple of weeks. To my fellow Pitt County residents, I say thank you. Thank you for following our recommendations. Thank you for your patience, which I know is wearing thin. And thank you for the many gestures of support and kindness my staff and I have received from you. I truly consider it an honor and a privilege to serve as your health director. To the staff of Pitt County Health Department, thank you for all your hard work and your willingness to improvise, adapt, and overcome the challenges that COVID-19 has placed on us as a local health department. I remain cautiously optimistic about where we are in this epidemic. We appear to have flattened the curve, and that is what we needed to do. Run through our case numbers very quickly this morning. Across the state, we're at 9,568 cases total. In Pitt County, 116 cases. Our estimated recovered number as of yesterday was 69. There will be a few added to that when I get to run that number back at the office today. In North Carolina, there have been 342 deaths. In Pitt County, we've had 2 confirmed deaths, 2 COVID positive confirmed deaths. We currently know of at least 1,089 people in Pitt County who have been tested. 116 or 11.4% of those returned as positive. 905 or 88.6% have returned as negative. We have 68 results pending at this time that we're aware of. I'd like to mention a couple of other public health issues this morning before I conclude. COVID snacking. I'm guilty of it. I confess I never met a chip I didn't like. We know that many of us are snacking too much and moving too little. We encourage you to snack wisely and to get regular exercise so that COVID-19 doesn't become COVID 20 pounds for you. It is mosquito season. No, mosquitoes do not spread COVID-19, but please tip and toss containers that may hold water on your property. This reduces breeding areas for mosquitoes that like to bite us. Rabies. Please remember wild animals like bats and raccoons can carry rabies. Bats, raccoons, and other wild animals should not be kept as pets. Please remember to update your dogs or cats' rabies vaccinations as recommended by your veterinarian. Smoking and vaping. Smoking and vaping do not make you a bad person, but they are bad for you, and you should stop. Smoking and vaping may be associated with more severe cases or outcomes in COVID-19, meaning if you smoke or vape, you can get sicker if you get COVID-19. It's a great time to stop. Please consider calling 1-800-QUIT-NOW for help. That's the North Carolina Smokers Quit line. And finally, please go home and stay home. I thank you for your time this morning.
You can stay right there. We'll go ahead and jump right into our media questions, starting with the order that the media called in, starting with WNCT, Ariana Kraft. Are you on the line? And do you have any questions for Dr. Silvernail?
Yes, good morning, Dr. Silvernail. When it comes to contact tracing, now the North Carolina Department of Health and Human Services is now looking to hire and train staff to support this effort in North Carolina. Is this something that the Pitt County Health Department is also engaged in right now?
We look at, we evaluate every case that comes to us, which means interviewing that individual, looking for contacts with that individual and offering appropriate advice to anyone who may have been exposed to that individual. So we're already doing that. The state is looking to hire additional folks because they really want to see testing ramped up across the state using the national guidance. They want to see us able to test 2% of our population per month. So what's 2% of 8 million? It's like, 160,000 a month, I guess. So a big number. And with that will come more cases. And they're trying to make sure that local health departments have access to additional temporary staff to assist with case investigation and contact tracing should it be needed.
So would you recommend anyone in the community to sign up for this, or what would you kind of say to that?
There is, and I do not have that sign up information. There is a website where people can apply to become contact tracers. This might be a good opportunity for college or other students to get some practical experience in public health and in contact tracing. So I would encourage them to do that. I'm not sure what the age range is that they will accept for employees, but I think it could be a good experience for some of our students.
Sure. And can you just kind of reiterate for people who might not be as familiar with this, why is this kind of effort important right now? You were talking earlier that this is a foreign disease to us. We don't have a lot on it.
Mm-hmm. As we get to the backside of the epidemic and we have more sporadic cases, it's going to be important that we contain those cases and those clusters and try to limit the spread and limit the size of any subsequent recurrence of the disease in our community.
One last question for you. We are seeing, less hospital cases right now and things like that, which is great. But when it comes to nursing homes, which is a very specific area, we're still seeing a lot of deaths and a lot of cases. So any comment on that right now, how you anticipate things to move forward for these facilities?
Certainly nursing homes and other congregate living settings, places where people live together, unrelated people live together, are high risk. Many of these folks are elderly or have underlying medical problems. So we are vigilant for that. We to date have not had a defined outbreak in a Pitt County facility. So we are watching for that, monitoring for that. And would offer whatever assistance that institution needed should it erupt. I know the hospital's also been watching for this and is willing to offer resources to facility here in Pitt County should that happen. But prevention is the best medicine, so we will continue to do our best to try to keep that out of those facilities if we can.
Thank you so much.
You're welcome.
Okay, next up in Teresa Bowles, if you're on the call, do you have any questions for Dr. Silvernail?
Sure. Just piggybacking off of what Ariana was asking, how do we protect the people who sign up to do contact tracing? Is there any health risk to them doing that? And if there is, how do we make sure that they're safe?
Generally, that's done over the phone. So we would not generally send those folks out on a person-to-person basis. If there was a time where we needed to send them out on a person-to-person basis, we would make sure that they had the appropriate personal protective equipment for that encounter.
Got it. And have you guys, are you involved in the hiring process at all? Have you already hired anybody, or is that kind of done through the state?
No, that's being done through the state. So we have not hired anyone for this specifically.
Got it. And I think some people are who are dealing with unemployment right now might think that this is a good opportunity, but maybe kind of are afraid because they're not sure either whether they're qualified or if it's safe. What would you say to someone interested but is not sure?
I would say look at that website link, and we can get that up on our Pitt County website, so people can find that for employment. It was in the press release that came out from the state. But we can put that up on our website, and people can look at the educational requirements for it and apply through that link.
Now, I know some counties, I just spoke to the Lenore County Health Department as well. They've already been doing contact tracing. Have you guys already got something set up for that now, and this will just be an addition, or is this new for you guys?
No, this would be an addition. Our like I said, our CD staff interview every case and look for contacts and take appropriate measures for those contacts.
Got it. I think that's all the questions I had.
Okay,
I will say, Mike, before we move on, with most of our case, we found the contact trace to be fairly short. And again, this is kudos to the medical community, kudos to the people in general, that folks have recommended or followed the recommendations. And then many times when we've called these patients, when they started to get sick, they self-quarantined or self-isolated. They were tested, they were in isolation, they've remained in isolation. So we have found in general the contact traces to be very short on the majority of our cases.
Got it. Thank you.
Okay.
You're welcome.
moving on now to the Daily Reflector, Ginger Livingston, if you're on the call and have questions.
Yes, hello, Dr. Silvernail. At last week's Board of Commissioners meeting, several commissioners talked about they thought the state should start allowing counties to have more control over their stay-at-home policies, and they wanted to see Pitt County begin to open up. Would you comment on that? Is Pitt County ready to open up?
Well, we're probably getting close. I stressed this when I spoke to the commissioners last week. My best guess was that we needed to complete somewhere between 3 and 5 incubation cycles before we reduced restrictions. This Thursday, we will complete 3 incubation cycles since we identified the first case here in Pitt County. I believe the behavior of this infection in communities is heavily tied to the population density of that community. And since we are less dense than other parts of the state from a population standpoint, we may be able to relieve restrictions or reduce restrictions sooner than some other parts of the state. But that would need to be a joint decision. Right now, we're kind of stuck. We're under the governor's order. So that would be our political leadership would need to receive that authority from the governor in order to make that happen.
And is the General Assembly or the governor agreed that a county should have more authority? After Thursday, would you recommend Pitt County opening up, and how much opening up would you recommend?
I think we would need to do some sort of a phased reopening while we continue to monitor disease activity in the community. I have not drafted any specific guidance on that at this point. Again, because we're sort of, we've been handed some things from the state that we've been told that we must accomplish from a state perspective first. So if that changes, we will change our approach as well.
When you say phased opening, what does that mean on a county level versus the state level?
It means that we could choose to allow restaurants to reopen at a limited or reduced capacity, that we could allow other businesses to resume operation with appropriate protections in place for their staff and customers. That would be spread out over time so as not to see a dramatic increase in transmission here in our community.
Is there anyone from Biden either on the line or at the commissioner's room that they would like to address this also?
This is Mike Emery here, Ginger. There is not a representative in here today due to some scheduling conflicts, but they should be here on Thursday.
Okay, thank you.
Okay, if that's all for the reflector, we'll move on to WCTI, Tyler Harden. If you're on the call and have questions for Dr. Silvernail.
Yes, good morning, Dr. Silvernail. Thank you for all of your insight this morning. I wanted to mention there was a new study by the University of Maryland that shows North Carolinians are getting out more and doing less social distancing. And I wanted to kind of get your thoughts on that, especially as we're coming into this, the end of the third incubation cycle. And I guess, what is kind of your message for the people who do have, cabin fever and they're ready to get out and get more active?
I hadn't seen that study, Tyler, so I'm not familiar with the details of it. I got a little cabin fever myself, so I'd love nothing better than to throw my kayak in the river somewheres, or maybe go over to Goose Creek and hike some of the trails over there. I guess those are open, although I haven't ventured out that far. I would encourage people to get out and be active, but to make sure that they do sanitize or wash their hands frequently, and that they try to avoid contact with others, at least within 6 feet of others, if at all possible.
Okay, and I know earlier you were talking about the case count numbers. Is there any modeling that you are doing or that you're seeing about how many possible cases are in the community right now, but just not in the count?
That's, Tyler, that's kind of hard to estimate. Again, everything in epidemiology is an estimate. I feel kind of like the weatherman this morning. No offense, weather guys, or weather people, weather persons. Some of the antibody studies have suggested that the real disease footprint in the community may be 5 times or more what we know from confirmed cases. So if we looked at 116 confirmed cases, that would put our total case count in the county somewhere north of 500 cases if it's 5 times. Part of that, as I said, is the idea of doing these antibody tests to help us really determine the footprint of this disease. We know for many of our younger folks, this has been a very mild infection, sometimes asymptomatic infection, especially in younger people. So trying to capture that number is difficult. One way to do that is to do that antibody testing and to look at those numbers and get an idea of, well, what was the true footprint of the disease in our community? And we will find that is several times the number of confirmed cases. It's just a matter of how many times that number of confirmed cases. Some authorities, some articles put that at 5 to 9 times the confirmed case number.
Gotcha. And I know as the state continues to ramp up testing, are there any kind of other forms of testing than the ones we already know about kind of coming down the pipeline to make that more easily accessible and, meet other people's maybe needs or, perspectives?
Mm-hmm. So Tyler, the first test that we were doing was that real-time PCR test, which looks for the genetic material of the virus. That's still sort of the mainstay of testing for people believed to have acute COVID-19. The antibody testing looks at both the IgM, which is the short-term or 2-week antibody, and the long-term IgG, which comes out at about 4 to 6 weeks. So that looks at someone who is recovering or is recovered from the infection. And then there's another class of tests that appear to be coming and probably not far from hitting the market or hitting the clinical arena. And those are called antigen tests. And what those would do is allow people to look for markers, protein markers from the virus in a person's blood, and that would also be useful for acute infection. So that is coming, and one of the estimates I heard is that's probably in the 2 to 4 weeks from hitting the market in the country.
Gotcha. And the CDC just put out some new symptoms of COVID-19, and I know a lot of times, as you mentioned just a few minutes ago, younger people can be asymptomatic or have that very mild case. Do you mind commenting on the new symptoms from the CDC, and also, kind of the moment that someone should look at either getting the test or getting the antibody test?
We are seeing some of those when we've done our interviews. We have asked about the taste and smell, loss of taste and smell, and we've seen probably in about 30% of our cases that someone has experienced a decrease or loss of their taste or smell. GI symptoms, when you looked early on in the history of this, and I still think we're early on at 4.5, 5 months now, GI symptoms were thought to be 3% or less. There was another case series published where GI symptoms, again, typically diarrhea, was up to maybe 50% of cases. So the symptom list that the CDC has put out, or the expanded symptom list the CDC put out, does seem to be consistent with what we're seeing in the case histories when we review those cases at the health department.
Okay. And earlier in your remarks, you mentioned smoking and vaping, are associated with more of the severe cases. Are we seeing that here? Because I know, that we've had an age range from 17 to 70s. Are we seeing that here? And can you talk a little bit more about kind of what that does to the body if you do have the virus, and if there's any other factors that could make a severe case beyond just underlying health conditions?
Yeah, long-term smokers are more likely to have chronic lung disease. We call emphysema chronic bronchitis, or labeled as COPD, chronic obstructive pulmonary disease. So long-term smokers clearly have greater risk factors for serious infections with COVID-19. Younger people may have a more severe course with COVID-19 if they smoke or vape, because the smoking and vaping produces a chronic irritation in the respiratory tree and allows perhaps that virus to invade the respiratory system more easily because our normal protective measures are broken down by smoking or vaping.
Okay, and just to kind of wrap things up, kind of following that question, is that age range for the cases here in Pitt County, is that still 17 to the 70s?
Tyler, I knew you were going to ask me that question today. So we did review birth dates on our folks. The youngest case we've seen has been in a 2-year-old. The oldest case right now has been 78.
Gotcha.
So very
awesome. Thank you. Thank you so much, Dr. Silvernail, for all you do. I appreciate it.
You're welcome. Thank you.
Okay, and we did have one follow-up question from the Daily Reflector. Ginger, if you're still on the line, please go with that question.
I am. With the antibody testing that is being talked about, when will that start? And can a person volunteer to be part of the antibody testing? How would you choose who's tested?
We will roll out, and there will be an enrollment strategy here, and yes, people can volunteer. We will reach out through a number of civic groups, religious groups, through our first responder groups. We will likely have multiple sampling stations around the county as that moves forward. A lot of this is still kind of in motion and in process. We anticipate that we will get approval to move forward with that in the next couple of weeks, and probably start the enrollment process in 3 to 4 weeks. Maybe short. Okay.
Thank you, Dr. Silvernail.
That's it. All right. Thank you, folks. Have a good day.
All right, and we do want to open it up for further questions from any of our other municipal or community partner organizations that are also on the line. Just a quick recap, I think we still have Pitt Community College, Pitt County Schools, Greenville Utilities, the Pitt Greenville Airport, and the City of Greenville all on the line. So we're going to go through the media list one more time and see if you have any other questions for any of our other partners on the line, starting with WNCT, Ariana Kraft. Any other follow-up questions?
No further questions. Thank you.
Okay. WITN, Teresa Bowles, any questions for any of our other partner agencies?
No questions for me. Thank you.
Okay. Daily Reflector, Ginger Livingston, any additional questions?
I have one question for Pitt Community College.
Okay. Rick Owens, Pitt Community College, are you still on the line and able to answer a question?
I am.
Hi, Rick. I apologize that if this information has already been released and I somehow missed it. What plans do y'all have for graduation?
It's right now it is looking like we're going to do graduation online. It'll be a virtual ceremony.
And when would that be?
They're working out the dates and logistics on it right now.
Okay, thank you, Rick.
Mm-hmm.
Ginger, any other questions for any of our other partner agencies?
I think I'm good. Thank you.
Okay. And finally, WCTI, Tyler Harden, any other questions for any of the other agencies on the call?
No further questions. Thanks, Mike.
Okay, just want to thank you again to all of our participants and all of those who are watching these media sessions. Our next media session will be number 14, and that will be on Thursday, again at 11:30. In the meantime, I would like to remind everyone that we have 3 ways to get the information that you need. That is on our website at pittcountync.gov/coronavirus. Also calling the hotline at 252-902-2300. Or by submitting a request form online at pittcountync.gov/COVID info. Thank you again for watching and have a good day.